Hello, hi everyone. I'm Dr. Erica Onegbola, pharmd, for close to 10 years now. I want to thank you for joining me on this particular video. Please like, share, and subscribe. Hit that button there. I would like to get 1,000 subscribers. 1,000 subscribers by the end of 2 months here. So please help. Please subscribe. Please like and share. Again, I'm Dr. Erica, pharmacist, and I have a good topic today. I want to talk about trans fatty acids, and cholesterol medications that can be used to help offset the high cholesterol that trans fats cause. So I want to make mention and let the public know what that is and how it can be avoided. Okay, so trans fats are man-made. They're manufactured saturated fats that are engineered to have extra hydrogen atoms along the molecule to ensure that food products and fast food, those hungry man dinners that we microwave dinners that we love so much, um, those type foods, fast foods, those type foods have these trans fats to help preserve them and to help avoid degradation of them while they're in processing, while they're out of the refrigerator, in the refrigerator. They can last for so long under certain conditions, and so can be stored and be purchased, so forth. So there is different types of fats that provide energy for the body and provide a way for cell membranes to become more stable, help with energy production, things like that. So I want to just make mention that trans fatty acids are man-made and manufactured. They increase cholesterol really fast and they increase cholesterol really high. And so the officials have decided to put on nutrition labels whether a product has trans fat included in the product. So if a product does have trans fat in it, the nutrition label will state that it does. And it's recommended to avoid all products that do have that label that says this item contains trans fat. So do be aware of that. Trans fats are not healthy because of the cholesterol risk and cardiovascular disease risk. Yes, cardiovascular disease risk can occur because cholesterol increases substantially. There are medications that, again, that help with cholesterol, but again, if we can avoid trans fats altogether, then yes, we want to do that. Okay, so if you have any questions or comments, please let me know. There are saturated fats and unsaturated fats. These fats are a little bit more healthier. The less hydrogen atoms attached to the fatty acid molecule, the better. So monosaturated and polysaturated are our unsaturated fats, and those fats are healthier and can be more tolerable with the body and does not cause the cardiovascular disease. Cardiovascular disease includes heart attack, includes coronary artery clogging, things of that sort. So we don't want to have those events, thrombosis, blood clotting, all of those factors are included in the cardiovascular disease. So do be aware of that. Saturated fats are more stable than unsaturated fats in food products such as your meat products and your dairy products. They're not man-made, but they do occur in nature in our animal products, okay? And they also increase blood cholesterol levels, but not as high as the trans fat. So do remember that. So read your food labels to find out whether a product has trans fats or saturated fats. That will help determine your choice of meals and how to look about getting foods cooked or getting them raw. However, the more raw vegetables, the more raw fruits are, the better. You might want to maintain protein or meats that are fish products like the salmon and the mackerel. Those type, the herring fish as well. Those type of protein have good fatty acids like the omega-6, the omega-9. All of those are included in our fish products and are healthy because those fats are very natural. Those fish produce those fats very natural, helping bring down cholesterol, helping to bring down cardiovascular disease risk. So do remember that when choosing protein in your diet, and also make sure that we are looking to avoid trans fats altogether. And again, that's your fast foods, your hungry man dinners, microwave products, all of those frozen food items that we see in the frozen food section are filled with trans fats because the manufacturer wants to preserve those products in storage at home, and also it gives a long lasting flavor. However, those are not healthy, and we want to avoid those altogether if we can. So do be aware that every now and again it's okay to eat something that is very delicious, like a hungry man dinner, but we don't want to become accustomed to that as a means of nutrition. Okay, stick to our vitamins, our minerals that are found in our raw vegetables and our raw fruits. The minerals, they are come from our soil and our natural well water. They can be found along with our fruits and vegetables. And then our vitamins are again in our raw vegetables and our fruits. But when we start to cook with those items, vitamins tend to become less because we're cooking and we're removing chemically those important essential vitamins. So do stick to raw fruits and raw vegetables if possible, like your celery, your tomatoes, your carrots, your that are rich in vitamin A and vitamin C, vitamin E as well. Vitamin D comes from the sun usually, and also in our dairy products. And then you also have vitamins supplements as well. If you're not getting adequate amounts of vitamins in your meals, you can also pick up a multivitamin or vitamin supplement. Also, I want to make mention that the fish products that contain omega-6 and omega-3 fatty acids can be consumed at least 2 to 3 times per week. But again, if you're not getting that in your diet, do consider a omega-3 fatty acid supplement. That can be krill oil, that can be just basic omega-3 capsules to be taken as well. All of those together help to bring down the cholesterol and help protect the heart over time against cardiovascular events and hospitalization. We don't want those, of course, so we want to make sure our cholesterol is brought down at a healthy stage. Okay, so let's remember that we want to prevent rather than treat. There are treatment cholesterol medications that are out there and that have been researched, post-marketed research. All of those medications, they're first class. They are still available on the market, and most of the side effects are going to be liver disease or liver issues, and then muscle tenderness or muscle pain in the lower extremities of the body. But mainly those medications are first class. I'm talking about the statin class of medications like your torvastatin or Lipitor, your simvastatin, your rosuvastatin, lovastatin. Those class of medications are first class when treating cholesterol. And so if you have high cholesterol and diet and exercise does not bring that cholesterol down, your doctor may consider using one of those statin therapies to help with that. There are also other classes of medications such as your niacin, also your gemfibrozil, and also there's another one that's like second class or second nature in prescribing, and that is your Zetia or ezetimibe. And that medication is also for anti cholesterol lowering and it's very good. It's on the market as well, and it comes in 10 milligram, just one dose, one strength only, and it's one in its own class. Excuse me, and that medication is similar to the statin medications as far as adverse effects. Um, and then there are the other lipid lowering medications, again, like your niacin, that may cause flushing as a side effect, but your doctor will taper you over time to a higher strength depending on whether it's needed. Also, or how effective that medication is, but usually they'll start you off at a small dose or small strength in the beginning, and then tape you up because of the flushing side effect. They want to avoid that as well, so they'll be particular about that. Also, there's gemfibrozil, that's on the market, omega-3 that I just mentioned, and also there are other over-the-counter medications that I've gone over before, like your coenzyme Q10, which helps to lower cholesterol over time as well. And then omega-3 is over the counter too. Your krill oil is over the counter as well. So those items can be picked up without a prescription. And they do come in with reasonable discounts and reasonable prices. Coupons are out there to help facilitate purchase. So do be aware of that if needed. But we do want to avoid cholesterol. I want to go over exercise, diet, and also maybe immunizations as well. So exercise is very good. 150 minutes per week of moderate intense exercise, such as exercising in a gym, working outside in the yard. That could also be like just brisk walk or a light swim. It could be stair stepping. It could be Pilates or yoga. Just as long as your heart rate is increased to 70 to 80% of its max rate. Also, there are weight-bearing exercises where you actually lift weights. That's good as well. I do recommend it. It helps increase your bone density and bone mass, help build muscle cells as well, get the muscles going and enlarge. So I do recommend that as well. So do be aware of that. That's 150 minutes per week or 30 minutes for 4 days out of the week. 30 minutes for four days. Okay, I do recommend that. Also, be knowledgeable of your nutrition labels. Be knowledgeable of cholesterol and calories, things like that. Your fats, saturated, unsaturated, your trans fat to avoid. And then also immunizations are out there too. Based upon age range, medical conditions, do be aware of that too. So talk with your local healthcare provider about getting those taken care of. And so I do thank you for joining me on today's topic. This vlog today was particularly about trans fats, cholesterol drugs that are on the market, prescription and over the counter. And I don't personally deal with cholesterol because I choose to exercise, stay active, stay energetic, um, just be on the go as much as possible. I do fast, and so some meals I don't incorporate into my daily activity. Maybe one or two good meals, healthy meals. I do utilize vegetables. I do cook, so that helps to bring down a lot of the fats and saturated fats that and increase my vitamin intake as well through my vegetables and through my fruits. So I do recommend that as well. If you have any questions, please let me know. This blog is pretty much just for the public audience. I don't have any more background information to give you all about my daily diet or anything like that. So sometimes I do like canned goods. Canned goods have a lot of sodium in them. I'll be honest about that, but I do like canned goods. I like the chickpeas or garbanzo beans. I like green beans. I love lentils. Quinoa is good as well. Quinoa is really good. It's a wheat or grass product, naturally from the Greek wheat or grass, usually in Indian or Eastern Hemisphere cultures. And I do enjoy products that are. I'm not a vegan, but I do like vegan products. I do like to substitute vegan products for meat products at times, especially if they are like um, from the frozen section of the store. I do prefer to utilize vegan products instead of the real meated products in those cases, just because I feel better in my mind knowing that I'm ingesting a vegan product that has gone through a process that's a little bit healthier. So meats I usually cook with poultry. Um, Meats such as fish, I don't usually choose fish to eat. I usually choose poultry for myself, for my family, or I will, or I will just um, snack on whole milk and cereal products, healthy cereal products, uh, which increases fiber. I do like wheat brand products that help increase fiber, which gives that daily bowel movement and also helps regulate the GI tract and keep it healthy as well. I do recommend that too. Um, Also, besides fiber, protein, you want to make sure you're getting vegetables, um, not starchy, non-starchy fiber non-starchy fiber vegetables. Okay, so avoid your those good squishy vegetables like your beans and so forth, your potatoes. Those are your squishy vegetables. They're good, but they are filled with starch. Okay, so do choose leafy vegetables that are leafy and green. Sometimes your tomatoes are good to incorporate. Your carrots are good to incorporate in your green leafy vegetables. It gives you vitamin K, which is good. And it also gives you fiber, and it helps to lower your cholesterol and blood pressure and your glucose tolerance. You don't want to have increased glucose, so you want to bring that glucose down. Make sure that you're in range and your weight. All of those good nutritional portions are good to help keep weight down, body mass index, waist circumference. All of those numbers should be at a minimum, if possible, at a minimum again. And it helps to, over time, decrease the chance of dementia, decrease the chance of Alzheimer's disease, cardiovascular disease, cholesterol disease, um, low bone mineral density. All of those help to come, da- come down to a natural and healthy state. So we do want to avoid um, fatty meals, meals that are starchy and sugary, because again, we want to avoid disease states, keep our life healthy and long, and have good quality of life where we can do the things that we choose to do. Okay. And also, last but not least, I want to advise that those who are tobacco users have the opportunity to quit tobacco use. There are programs out there to talk to you and counsel and help choose a quit date. And if there's medications that may be needed, medications can be added if necessary, or whether prescription or non-prescription. There's nicotine patches, nicotine gums that are available over the counter at reasonable prices that can help with that day-to-day craving prevention. And also there are prescription medications as well that can help with the long-term outcome up to 8 to 12 weeks of use to help quit tobacco use. And I do recommend that, just because tobacco use is very, 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 very unhealthy. It increases the chances of heart attack, um, increases the chances of clotting of blood vessels, increases the chance of bone fracture in the body as well. The vertebrae, the non-vertebrae, the hip, all of those are at risk of fracture. The older a person gets and they continue with smoking, the higher the risk of bone fracture. So do understand that tobacco use should be avoided as soon as possible, and you just want to have a good quality of life and be able to spend that time with family and friends. So I do recommend that. Okay. So this video was about trans fats, and I hope that that information sticks with you all. Again, it's processed fats that are man-made, processed fats that are manufactured and implemented into the food. So we know that engineered man-made products to help with preserving products or the preservation of products is no longer healthy and should be avoided if possible. And that's our fast food restaurants, our microwave dinners, our foods that are our snacks and baked goods that come in those wraps and in those nice packages. All of those are filled with trans fats. Again, that's your snack foods, your chips, your cookies, your baked goods. That's your chips, your cookies, your baked goods as well. So do be aware of those. And so I hope to have been beneficial on this video. Please like, share, and subscribe. I'm Dr. Erica. I'm signing off on this vlog, and I hope to see you on the next vlog. Have a good day. Bye.